Lights out.
Welcome, everyone, once again for another fantastic episode of Sleep Tech Talk, the Sleep Podcast, with your hosts and friends, Emerson Kerr, Robert Miller, with the hands up. For those of you who are not watching on YouTube, he's got his hands up, raising the roof, and here trying to keep the roof up is your friend and co-host, Jerry Moneycarode. And before we move forward, I'm going to toss it off to Emerson to give you a little idea of who our guest is today. Emerson.
Outstanding. Thanks, Jerry and Robert. We're really pleased to have with us today Dan Herold. Dan has been leading the sleep lab at the Mayo Clinic in Rochester for quite some time. We met a few years ago on a project that we were working on with Dr. Morgenthaler, and it's been a lot of fun to get to know Dan. I was hoping to summarize Dan's resume, but it might be the longest resume I've ever seen in my life. But quite an accomplished career. Started out in sleep in the mid '80s. I definitely am going to have to ask Dan what his registry number is, because he became a registered sleep technologist in, I believe, 1987. So I'm going to guess it's a lot lower than mine and the rest of us. But Dan has just been a part of a great sleep disorder center that's grown not only across the country with key locations in Jacksonville and in Arizona, but also around the world. And what Mayo Clinic stands for is just a center of excellence. I believe they're a 5-star hospital, which definitely tells you a lot about their commitment to quality, to be recognized by their peers in such a manner. But Dan, as a sleep technologist, and I think this is really great to see as well, as he's a former president of the BRPT. I believe it was chairman back in the day, but I think you held 2 other offices in there. I think you ran the circuit, secretary and treasurer, but also would have been a part of the APT, which is now the AAST. So Dan has not only led in his community, but he's also volunteered and served and led in our national organizations, which is tremendous. I mean, tons of respect there. But Daniel, one of the questions we love to ask is, how did you get here? Because the 3 of us, sleep is not what we were planning on, but we kind of backed our way into it. And if you can, once you answer that quick question, is, you guys have gone through a lot of change at Mayo. I know COVID, from talking to you and Dr. Morgenthaler, really thrust you into a lot of change, but you were really thinking about it before then. And I would love for you to once you tell us how you got here, is give us a quick idea of what that change meant for you and your team and the physicians there at Mayo Clinic.
Sure. Well, my registry number is 346. So I got into sleep for a few different reasons. I liked the hours. I was a night person, but I started at Mayo in 1981, and I got into the sleep lab in 1986, worked a few jobs. I was an animal care technician with experimental mice to begin with, and I did some clerking in the x-ray files, and then I got into the electrocardiogram laboratory, and it was at that time I spent most of my time in the ER and the ICUs, and trying to learn as much as possible about that type of thing. But then I heard that sleep was 4 nights a week, and I thought that would be fun, and I thought it was an area that I could find a niche, and I feel like I did find a niche into the sleep laboratory. And I was hired by Cameron Harris, who's even lower than mine, Emerson, who's just recently retired. But to answer the second question, is that prior to COVID, we had started to look at the changing landscape that we actually had here in sleep medicine, and how technology was taking over, doing some of the things that we were doing as part of a normal job as any sleep technologist. And we looked at what has changed and what hasn't changed over the time. What do sleep techs still need to do? and what do sleep techs need to advance on. And as we at that time, and then all of a sudden COVID hit, and all the brakes were put on that. The interesting portion of that is the experience during COVID, where we had to switch gears very quickly to a more in-home type of testing, which we had been moving a little bit towards, but COVID now moved it to there, and doing, CPAP titrations, even trying, what do you do? Just answering those questions. Should we do them? And those kind of things, and deciding not to, and then getting all the circuits and all the filters and everything, masks that we needed to still try and take care of our patients in the best way that we could, has put us on a fast track to where basically we've moved into today, which was part of my talk that we had met at a few weeks ago. So.
All right, well, I'll jump in, Dan. I know that we started talking about this a little bit, and I gave the example because I think it is interesting to think about sort of a research, and maybe you can talk a little bit about the types of research studies that you guys are working on at Mayo today, and maybe not, depending on what you're able to disclose. But I know that certainly working in an academic setting, at times could be very different than a local hospital-based sleep center. And I think that this is an opportunity for sleep techs who are in our audience to be able to hear what those differences are, and maybe they're looking for that type of situation that would allow them to expand the their knowledge and the types of patients and things that they deal with in the sleep lab.
Well, it's interesting. I really know nothing different, so it's a little bit. Although I have been able to see a large number of laboratories in the country. I work with the BRPT, but there's an expectation of working with our three shields, which is clinical research and education and teaching the next batch. It's working, yes, you're right. I can't talk about specific research. Love to. That's currently ongoing, but we have a pretty large sleep laboratory right now. We're currently, footprint wise, we have 24 beds in our laboratory, and we have then laboratories, 8 and 6 beds elsewhere, and some other even smaller ones. But so we do clinical research, we do retrospective research. Technologists can get into volunteering or being part of a protocol. We do a lot of that. And it's basically just putting yourself out there and saying, hey, I'd like to help and get my feet wet with this type of stuff. That's how I did. I said that back in 1987, I think. And I just said, I'd like to be involved in some of the research that we need. And, and all of a sudden I was given a protocol to come up with what does the data say for the first night effect of CPAP on patients, because then we did 2 nights of CPAP. And so I did the research back on what the items were, or what the literature said back then, and there was nothing. They all said that there was no such thing as REM rebound and slow wave rebound, or it was very light in their thing. And my anecdotal understanding was there was significant REM and slow wave rebound on the first night of CPAP therapy. And so I wrote it up, did an abstract. It got accepted for APSS for a full 15-minute thing. Back then you had slides and everything, doing all that kind of stuff, and had to develop that and got learning into how to do all that stuff. It wasn't PowerPoint, obviously, but I gave that talk, and I was scared, and I was really young, but I got into doing more and more research just because I put my name out there. And that was the one thing that I can, how do you evolve? How do you get involved, statewide, nationally, is putting your name out there and saying, I'd like to volunteer. I'd like to be a part of that. I'd like, at my job, you can be part of our work too, but you have to do all your other stuff. But, we do a lot of pediatrics here too. So we have people that, put their name out there and say, we like to do that, and that's the best way to do it.
All right, so this is going to be a question that may take you, it might catch you off guard just a little bit. But tell us the most interesting story. You've had the longest sleep career out of anyone on this call, and you have to have had some experience over the years that you just look back on now, and maybe it's funny, maybe it's not. But what would be the one moment that you would you'd pick out and want to tell the story about that experience?
Boy, with not getting into patient-specific stuff, we've had a lot of interesting patients over the last, 35, 40 years that were there. Probably the most requested story that I tell is my involvement with the BRPT. And I'll try and make a very long story short, is that I was working nights, and I was doing the exam down in Greenville, North Carolina, and I got off work and I left, and I went and flew partway there, and it was right in the middle of a hurricane. And I had to try to find my way to there because I had all the test materials, and I was doing that, and so I finally got within driving distance, and I went to rent a car, and I got into a car, and a guy said, hey, why don't we split it, because I'm going to Greenville. And he was driving, or I was driving, and we started getting there, and the talk became very, very abnormal and very scary, and it was in the middle of, we were literally in the eye of the hurricane, driving in North Carolina where I knew nobody. And he looked at me and he said, I'm really lost. And he took me down a old tobacco dirt road. And I mean, I'm not very big, but I was talking a really big game right there. And, I used my loud voice to scare that person enough to get down the road. I must have drove about 100 and 110 miles an hour down this dirt road. I was so scared. And I left him in the middle of a four-way intersection where two highways meet. That's the Research Triangle down there, right? And I was at I can't remember which one, Pitt Memorial or whatever, and left him in the middle of a hurricane, and just told him to get out. And he got his bag and left him right in the middle of there. And it's probably the most requested. It gets very involved and obviously can become very colorful, but in general, that's probably my most requested story.
Well, as three Southern guys, we certainly understand that question. You're not from around here, are you, boy? Yeah, that can be frightening all by itself. Well, Dan, one of the things that I've enjoyed in our relationship and with your doctors is not only have you guys have been on the forefront, like you said, with REM rebound and complex sleep apnea and so many things that you guys have changed our lives without a doubt, particularly that with, the ASV technology. But one of the things that I enjoy too is that you're so forward thinking. And, when last time we were working together on a project, you guys had just put Epic in, you were learning how to work with it. And ever since then, now you've got Epic integration. You've got some really amazing things you're doing with that, and your own AI, which blows my mind. So, when we were in Birmingham at Southern Sleep Society, you were talking a little bit about that, and we're all thinking forwardly, knowing that AI type technology is part of our future. Can you touch a little bit on that? I realize there's some things you can't talk about, but how can others learn from what you're doing with Epic, with this new technology to help your sleep center?
Sure. It is just what you said. It's been a learning curve with Epic. I think everybody would agree that takes place in the healthcare field. But yeah, you had mentioned Dr. Morgenthaler, and all of our sleep physicians here. We have a lot of them And typically the culture around here is a very forward-thinking, where do we go? Where are we going? How do we get there? And those type of things. And they encourage, thoughts. They encourage ideas because they have them themselves, and how to get that done, and how can we do that? Who's the touch point that I need to start this project? How do we start? And I think it's a question, like at the Southern Sleep Society meeting, there was a lot of talks on AI, but very few people know anything on how to get data into some sort of AI format and get learning and things like that. I'm not the greatest at it myself. I'm learning as we go because we're encouraged to say, well, this is where it goes. And we have a lot of resources, and not everybody has those resources, but it starts with the general encouragement and the ideas that flow in a very collegial environment here, which is something that, I think people that work here are very, they absolutely love, that encouragement and the forward thinking portion of that. We're trying to do, tearing apart the sleep study, and what can we do to have artificial intelligence tell us about not only sleep apnea, but cardiac disease, pulmonary disease, all those things because we have the nice thing about sleep is we have this large bank of information that we're recording, that a bunch of squiggly lines, yeah, but it actually tells a story. And how can we use technology? And that's pretty much my role, is to how can we use technology to get that in there, specifically with also things with Epic, such as API or HL7 interfacing with clouds, with how can we do that? And it's like, well, I don't know, but I need to find out. Yeah, Dan, you need to find out. So that's pretty much it. And it's again, just asking questions and touch points to where you need to get them.
Dan, thank you so much. That's very interesting to hear, especially when you're talking about incorporating newer technologies. When you think about where it started from paper and then electronics, that was huge, but now we're looking at artificial intelligence. And thank you so much for that. But we're running out of time. Is there anything else you'd like to add real quick before we go?
I guess just thank you everybody here for inviting me and being allowed to talk on this. What I'd like to do is encourage sleep technologists out there to don't stop asking questions about what you're seeing. Remember that, it was realistically sleep technologists who first questioned REM behavior disorder and brought that in. Let's say slow wave and REM rebound. It was, don't stop asking the questions, document and ask questions about what you see. If it's abnormal, find out what it is. Don't stop learning, and don't just think, well, this is what I do for my job and that's it. There are those situations where you have to do that, but there's also a lot of situations that we don't know about in sleep yet that are just sitting there waiting for a technologist to ask a question to say, boy, that looked weird. I need to find out about it, and I better tell somebody about it to see if they think it is too. If it's not, you've learned something. If it is, you've learned something.
Well, thanks, Dan. We sincerely appreciate that. And those are definitely wise words. And but we thank you so much for joining us, and we sincerely appreciate your time. And for all our viewers and listeners out there, we thank you for your support. We ask you to continue giving us the likes on YouTube, the star ratings on your podcast platforms. Please don't forget to add a review on that as well, and continue to share it with your friends outside of just yourself as well. And with that, we want to say thank you all once again, and until the next one, lights on.